Hello, everyone. A very good evening to everyone joining our session today. Just to give a brief introduction, I'm Dr. Rutresh Rao. I'm a medical officer and also a community outreach lead in National Cancer Society of Malaysia. So, today we're going to have a very good session where we're going to talk about cervical cancer and the importance of HPV vaccination. So, let's go on, guys. All right. What is HPV and cervical cancer? To just talk a little bit more about what is cervical cancer in the first place, and then moving forward, we will actually touch a little bit on HPV vaccination. All right. So cervical cancer, in general, why is it called cervical cancer? Is because of cervix. Where is cervix in particular? It's actually the birth canal in females. A cervix actually connects the vagina, the birth canal, to the upper part of the uterus. And the cancer which grows out of control at this particular part is called cervical cancer, right? Okay, so if you can see the picture here, we are actually showing on the left side, you can see a normal cervix. This is how a normal cervix would look like. It's very smooth and pink in color. And once the person actually gets cervical cancer, that is actually the image of the cervix that actually is being diagnosed post diagnosis of cervical cancer, which you can see the surface is very rough, it's very friable. You can see there's multiple bleeding there and also multiple lesions. So just to go back again, this is cervix. Cervix is actually below the uterus and also above the vagina. So that is cervix, and hence when that particular part of the body gets cancer, we call it cervical cancer. Right. Okay, so how do normal cervical cell develop into cervical cancer? Right. So basically, the most common cause of cervical cancer, as we speak of it, is actually HPV infection. HPV, human papilloma virus. It's actually a virus. It's spread through a certain of level of sexual contact, and also through other contacts in which why we actually women actually get HPV infection. And thus, after being infected by HPV, 10 to 15 years down the lane, they actually get about a low grade abnormality and a high grade abnormality at that particular site of cervix, which actually develops and becomes a cervical cancer. Right. So it's actually not a day or two kind of process. It actually happens along 10 to 15 years. And that is why when we preach about HPV vaccination, we always target young girls, right? So let's look into more details about that later. Right. So, what are the statistics that we know about cervical cancer? That cervical cancer is the fourth most common cancer among women and seventh in overall, with estimated of 604,207 new cases in 2020 alone. We're talking about a year diagnosed cases, and about 90% of new cases and deaths worldwide in 2020 mostly occurred in low and middle income countries, in which Malaysia comes in as well. And there were an estimated 341,831 deaths, just deaths from cervical cancer worldwide in the year of 2020, which is accountable to 7.7% of all female cancer related death. So we can see how serious cervical cancer is based on these statistics. Yeah. All right, and also let's go down to our own National Cancer Registry, which was actually published by the Cancer Institute of Malaysia, where we can see that cervical cancer is the third most common cancer among women, and it is also one of the most dangerous cancers that actually lead to death, right? And only we also realize that 41% of cervical cases, cancer cases, are actually detected at late stages. When we say late stages, we are talking about stage 3 and stage 4 here, in which by the time it's very difficult for us to actually treat, and in which certain times at stage 4, chemotherapy will no longer be effective at this point of time. right? So we are also realizing based on our own statistics that up to 41%, that's almost half of the cervical cancer diagnosed patients are actually on the later stages, yeah. And when we look at the 5 year survival rate, so when we speak about 5 year survival rate, we are actually talking about how many, for example, out of 100, how many would actually survive the next 5 years once being diagnosed with cervical cancer. So if a particular person is actually diagnosed with stage 1 cervical cancer, their 5 year survival rate is about 75.3%. That means 75 out of 100 ladies would actually survive through the next 5 years after being diagnosed with cervical cancer, which is very good. That means the survival rate is actually very high. And also in stage 2 of cervical cancer, we can see that it's about 52.3%. That's about 52 out of 100 women being diagnosed by cervical cancer to be able to survive the next 5 years being after being diagnosed of cervical cancer. And moving forward on stage 3 and stage 4, you can see that the statistics is very low, where only 31% out of those who are diagnosed for cervical cancer go through the next 5 years at stage 3, and also about 23% survive through the next 5 years at stage 4, which is very low. That is why we always encourage women to do pap smear once they are sexually active. Always encourage them to do pap smear every 3 years once, right? So, what are the general signs and symptoms of cervical cancer? What we can see here is that basically some of them would have abnormal vaginal bleeding or discharge. This can be related to some infection, but also can be one of those signs and symptoms that to look out for cervical cancer. And also bleeding after sexual intercourse will also be one of the symptoms. Weight loss, fatigue, and loss of appetite will also be one of the symptoms. Bleeding or spotting during menopausal, or swelling over one particular limb, lower limb, would also be one of the important signs and symptoms to look out for. And also those ladies who have persistent back, leg, or pelvic pain will also be one of the signs and symptoms of cervical cancer. So if any of you are actually going through any of these signs and symptoms, please do go and see your nearby general practitioner, or you can also come down to National Cancer Society, in which we have a cancer health and screening center where we do a lot of general screening, where we can also provide pap smear tests as well. Right. So, what are the screening methods to know about cervical cancer or any abnormalities pertaining cervix? So, there are two types of tests that are available. Number one is, of course, the most common one that we speak about, which is the pap smear, and also the second one would be HPV DNA test. All right. So, talking about this, let's get a small break here. So, we have a special guest today. I'll just give a brief introduction. We have a cervical cancer survivor herself, Miss Mindy, who's actually on board with us today. And we're just going to have a short conversation where we actually get to know how is her entire journey of being diagnosed, after being diagnosed, and also pre-diagnosed. Hello, Miss Mindy. How are you?
Hi, I'm good.
All right. So, as we see, we are actually going to have a very short conversation, Miss Mindy. So, Miss Mindy, let's talk further about your experience from being diagnosed of cervical cancer and all. So, can you please introduce yourself once again?
Okay, I'm Mindy. I'm 34 this year. I'm a mother of two, entrepreneur. I found out my cervical cancer back in 2022, which means it's just like 2 years back.
Right.
Mm.
Right.
Then how I found it was from my annual checkup. Doctor told me that my pap smear report is not so good lah. So he referred me to the hospital for further checkup. Because I'm the one without any symptom.
Right. So you did not have any symptoms like having
No.
discharges or any pain or what? It was just through your regular checkup of pap smears, right?
Yes, yes. And then doctor is quite surprised also because maybe I've been doing workout since like 2020, and then I've been living healthy, eating very good food, so I don't suffer from anything. So when doctor got my specimen after the biopsy, then doctor also cannot believe with the result. So before we go for operation, he decided to go for another lab test before we go for operation. So which means doctor already did two lab tests for me before the operation.
Right, right. So
Uh,
you have gone through twice biopsy to actually
yes,
confirm that whether there was cervical cancer. Right, right,
yes,
right.
yes, yes. Because doctor also cannot believe. He said, "You look so healthy." Yeah,
Yes, I can
that's
see. Right. So, what are the type of treatments that you actually underwent for the cervical cancer?
okay. First of all, I've removed the whole uterus. And then we went the operation lah. Then we went through 5 chemo, and then 25 radiotherapy, and then
Wow.
also 3 brachytherapy.
Wow, that must have been very difficult for you to actually undergo the entire process of treatment. It's not as easy as it seems. So, how was it? How are you actually now post treatment? How are you managing, coping with at your current daily routines and all that, Miss
Okay.
Mindy?
Okay. Actually, honestly speaking, I did not take any hormone therapy so far. After 2 years, doctor say if I'm still okay managing with all the side effects, then he will just leave me alone lah. Because I say I'm not so keen to go for hormone therapy, so he say he will not force me first. And then what am I suffering from is that hot flushes, and then maybe I get tired very easily. So how do I remain myself to be more energetic? I have to go for more workouts. That's why I'm very heavy doing workouts.
Right, right,
Mm.
right. So you are actually currently undergoing some forced
Yes,
menopausal side effects, right?
yes,
So
yes.
because of your, yeah, but you're not, as you're speaking, you're not actually taking any hormonal therapy,
No, that's why
right?
I'm
So
I'm still suffering from all the side effects, but it is still manageable. So I'm not going to take any hormone therapy yet.
right, 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 right. Okay, so that's really nice to hear that you're coping out really well after your treatment. And just to tell everyone, Miss Mindy is actually one of our ambassadors in National Cancer Society.
Yes.
She's one of our greatest cancer survivor who's always there to support for all the other cancer survivors as well. So, Miss Mindy, can I know? So, basically, since you yourself are a cervical cancer survivor, what is your take for HPV vaccination?
Actually, I knew that it is cervical cancer is one of the cancer that is very preventable. That's why when
Right.
I saw NCSM got all of the HPV injection, what they are doing is like they do free HPV injection for the youngsters nowadays. I really encourage my friend to bring over their daughters there. Since it's
Yeah.
preventable, why not we do something before anything happen?
Yes,
Because
and
I,
you
I already
yourself,
suffered from the journey. I don't wish
right?
people who I love and care went through this journey again.
Yes, yes,
Mm.
yes, yes. Thank you so much, Miss Mindy. That's a very, very valuable input. I understand that you are in a very busy schedule today,
No,
and
it's
thank
not.
you so much for making some time for us and also for our audience today. I
We hope
really
can help
appreciate that.
more people and share more awareness lah. Don't be afraid of cancer. We are all here to support, and I guess NCSM is a very good community.
Right. Thank you so much. Thank you so much, Miss Mindy.
Thank
So
you.
have a great day. Thank you so much for joining us for this session.
Thank you.
All right. Thank you. So that guys, I think thank you. I mean, this was a very last minute plan up where we actually had one of the survivors to come in board. Miss Mindy has always been a very good supporter, and she has always been a great role model for all the other cancer survivors. Going through five chemotherapy, 25 radiotherapy, and also another three brachytherapy is not easy. It's not a joke. And also she herself being at the age of 34, managing two kids at home is definitely not a joke. So, looking into her personal experience, she has herself come out. to be one of our own ambassadors, where she actually goes and preaches about the importance of HPV vaccination, because cervical cancer is a preventable cancer by itself. So 90% of cervical cancer is preventable if the particular person actually takes HPV vaccination, right? So let's continue back in our sharing session about the screening methods. So pap smear test is actually something where the doctor scrapes off the surface of the cervix to collect some cells for examination. It's actually encouraged for those who are aged between 20 to 64 years old to be done once every year for the first 2 years. And if the 2 years result are normal, you can actually do once every 3 years. That is a standard practice for pap smear. And for HPV DNA test kit, it is actually for those sexually active women aged between 30 to 49. And it's very easy, just that it's a bit not so cost friendly. But once you have done it once, it's actually valid for the next 5 years. You just have to repeat the test in the next 5 years, right? Diagnostic methods, we also have colposcopy, in which where the test will be conducted by a doctor. If the pap smear test results show some abnormality, we will actually open and see if there's any abnormality seen at the site of cervix. And post that, we will actually take a abnormal cell or tissue at that point to send in for a biopsy test, right? So, what are the treatment options that we have for cervical cancer? Is, as we spoke to Miss Mindy, first they would actually remove the cancerous tissue through an operation. So, the surgery is mandatory. Following that, we will actually patients will actually go through chemotherapy using special medication to actually shrink or kill the cancer cell, given in the pill form or taken through your veins, or sometimes both. And radiotherapy is actually in which where we will use high energy rays like x-rays to actually kill the cancer cells, right? The biggest factor for cervical cancer is a preventable infection. Guys, I say this again. It's by a preventable infection caused by the human papilloma virus. And 95% of cervical cancer are cases due to HPV infection, right? So, how do we protect against cervical cancer? Number one would be HPV vaccine, which is almost 100% protection from HPV, and also to go for regular cervical cancer screening, in which where I explained pap smear must be for those who are starting off. 2 years consecutive to take a pap smear, and if it's normal, to take every 3 years if it's a pap smear. And if you opt for a HPV DNA test instead, it's just a test that is going to be done over every 5 years. And also, how do you also protect yourself? Please adopt a healthy lifestyle. When we say healthy lifestyle, we are talking about a balanced diet and also regular exercising. These are the things that would always protect you against any sort of cancer, right? And let's come to HPV vaccination itself. So HPV vaccination involves receiving a vaccine which is designed to provide protection against various HPV subtypes. We will go through the HPV subtypes that we are actually providing at the moment. Vaccine stimulates the body's immune system to produce antibodies to fight against HPV, and one dose of HPV vaccine is about 0.5 ml and is administered through an intramuscular injection through your deltoid region. So this is your deltoid region, and this is where you actually receive the HPV vaccination, right? So how does the human papilloma virus work? So once the HPV vaccine is injected into our body's immune system responds to the vaccine by producing antibodies to fight the HPV virus. And these antibodies build up in our body without causing an infection or reaction as well. And the antibodies will act to fight the infection and remove virus when there is an infection caused by HPV, and the immunity towards HPV is well established henceforth, right? So, what are the types of HPV vaccination that is available in Malaysia? So, at the moment, what Ministry of Health is giving through almost about 15 to 20 years of program in Malaysian schools are the vaccine called Cervarix. It is a bivalent. When we say bivalent, that means it prevents two high risk subtypes of HPV. So, as we speak of HPV infection, the virus itself has about 52 high risk subtypes. In which, sorry, it's a mix of high risk and low risk subtypes. It has about 50 over different types of subtypes. And among that, the most common one would be HPV 16 and 18, which is actually given through the HPV vaccination called Cervarix, which is actually an active program implemented by the Ministry of Health through Ministry of Education in all schools in Malaysia. And this is actually targeted only for the females. And moving forward, we also have Gardasil 4, which is a quadrivalent, where there's nine strains, nine types of HPV risk type, which is covered, which is HPV 6, 11, 16, and 18. And this is actually targeted for males and females. They can actually take this vaccine. And Gardasil 9, which is actually a nine-valent vaccine, in which where there's nine strains of HPV in which covers 6, 11, 16, 18, 31, 33, 45, 52, and 58. And this is also something that we are making it available for males and females, right? So let's talk about separating some facts from fiction and updates on HPV vaccination. So I'm going to break a lot of myth today about HPV vaccination. So, like, what are the myths about how they affect us and all that? There's a lot of vaccine hesitancy among Malaysians. And when we talk about global acceptance on HPV vaccination, the unless there is a proper awareness or education about the importance of HPV, the complacency or the hesitancy is definitely very high among people, and this is actually a data done globally. So, what are the first myth that I would like to break today is vaccine is unsafe. So, first of all, the vaccine, when it actually comes into implementation, before licensing by FDA, there's already 60,000 people being studied to ensure the safety. So they are also monitoring all the ER visits and hospitalization for 60 days post vaccine for all the 60,000 people. And there's a check for 200 categories of illness at that particular time. So definitely this is before licensing. And after licensing, HPV vaccine has been given out about 70 million doses. And the safety monitoring is up in almost 80 countries, and there's never been any serious safety concerns. So HPV vaccination is definitely very, very safe to take. And myth number two that I would definitely want to break is vaccine is unnecessary unless you are sexually active. This is definitely a big no, everyone. So, why we give HPV vaccination is actually it's a preventive nature of vaccine. Work only if given before coming in contact with virus, and younger people create more better antibodies to vaccine so that it's a better protection. As we know, like for example, when we actually give this Gardasil 4, Gardasil 4, if we are giving it to people, girls who are within the age of 13 to 20, we just only have to give them a single shot because their body, younger people, can create better antibodies with just a single shot. But those who actually take the vaccine after the age of 20, they are not the body would not really create a good antibody system. Thus we have to give a two shot. That means we have to give vaccination in two different shots in a period of 6 months. So infectivity of HPV, almost everyone will be infected by HPV at some point of time. And when given younger, more effective, and it provides two times the protection at 14 years old than at 15 years old. So this is just a simple example to give everyone, right? And myth number three would be vaccine is only for females. So, as I spoke just now, for example, Gardasil 4 and Gardasil 9, both of it you can actually give it for both males and females. Boys and girls can get HPV. 4 in 5 humans will get HPV. And why are we giving to girl? Why are we giving to boys as well? Because HPV infection does not only cause cervical cancer, it also causes some other genital related infection like genital warts, and also in men it can also cause penile cancer. So these are one of the reasons why we also give it for males as well. And vaccination for boys will ensure they are less likely to spread HPV to future partners. And the benefits for men here would be protection for genital cancers, as I mentioned earlier, and also cancer in throat, penis, anus, and also the genital warts, right? Myth number 4, vaccine does not work. So, to emphasize here, based on the research done, years of research done, this is definitely HPV vaccination is already in implementation for more than 30 to 40 years, and there's been a lot of clinical trials being taken at. So, we are very confident that it's 100% effective for females, in which we have phase 3 clinical trials among 16 to 26 years old women. Out of them, about 20,000 of them, in these women who had high risk HPV infection, there were no abnormalities. In example, there's no pre-cancer lesion. That means those who were actually given HPV vaccination at the age of 13 to 14, they were taken into clinical trials, about 20,000 of them, and they were actually positive for HPV infection, but there was no abnormalities, right? And also, when we see there's 90% effective among males, in different trials, we actually took about 4,000 males from 18 countries, and 90% effective in preventing genital warts and abnormalities associated with penile cancer as well. Right, moving on with our next myth, vaccine encourages sexual activity. There is no correlation at all. We are definitely not encouraging sexual activity here. What we are trying to encourage is to prevent the disease itself. People are actually saying, oh, so if we actually administer HPV vaccine, we would actually encourage them to be also, they would not get a cervical cancer, and they are encouraged to actually involve in sexual activity. No, studies are looking at HPV vaccination and sexual related outcomes. For example, pregnancy, STI testing, or diagnosis. These are actually no relation at all. So the confounding age of onset of puberty, that is what we are actually implementing the HPV vaccination among youngsters, because we do not want to encourage the sexual activity. We want to preach them that this is actually true sexual contact, right? And myth number 6, vaccine. Everybody knows about it. So what we got to know in Malaysia, based on a very simple study, is that more than 50% of our Malaysians do not know what is HPV vaccine, and about 60% of parents have no idea about the existence about the vaccine. So the provided recommendation is a single biggest predictor. That means where that is why we are trying to create a lot of awareness. We're trying to go down to a lot of grounds in which where we're trying to create a lot of awareness. Like as you see for today, our entire topic is actually emphasizing on HPV vaccination, right? And myth number 7 would be vaccine kills people. I think this has been a practice since COVID vaccine as well, because that particular person already has been diagnosed with multiple comorbidities, even being diagnosed with cardiovascular disease and all that. But they are also correlating with post-COVID vaccination. So these are the things that are actually happening by chance and all that, and the incidence is also very low. So what we are trying to tell is that vaccine does not kill people. It only increases your entire immunization. It builds your immunity, and the adverse reactions and side effects are same as every other vaccine. You would just probably get some pain over the site of vaccine, some redness, swelling at injection site, some minimal allergic reaction, and that is also if you're allergic to yeast. Otherwise, if you're allergic to anything else, you are very safe to take the HPV vaccine, right? And myth number 8, which vaccine causes infertility. There is no data that actually says that vaccination is actually preventing women's ability to get pregnant. It's actually this HPV vaccine actually protects the fertility. It prevents any further gynecological problems related to cervical cancer or cervical related any gynecological problem through this HPV vaccination. And myth number 9 here is vaccine effectiveness wears off. So at the moment, what we are studying is that what we know at the moment is when this Gardasil 4 is given at a single shot, it is actually a lifetime. It's a lifetime dose of creating immunization. But after 20 or 25 years, we can actually check the HPV antibody titer, in which where we can also give a booster dose. So in which where there are some ladies who actually come to NCSM grounds and ask whether they can get a booster dose even though they have taken HPV vaccine about 20 years ago. We would check their titer and we'll also come down and say that why not you take a booster dose, right? So it's very similar to hepatitis B antibody levels as well. We can check the level and also decide whether we want to give a hepatitis B booster, very similar to HPV as well, right? And myth number 10 would be vaccines has harmful ingredients. It has aluminium. So like all vaccines, HPV vaccine also has aluminium, but the content is very, 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 very low. Based on actual statistics, and an average adult actually ingests about 7 to 9 mg milligram of aluminium a day, and this vaccine only has about 0.225 mg aluminium per dose, and it has been reviewed and found safe by global advisory committee on vaccine safety by the WHO themselves, right? So definitely does not have any harmful ingredients. And if already vaccinated, no need to do pap smear is another false theory that I would like to break as well. So if you're vaccinated, you definitely still have to follow the screening protocol that is actually standard in Malaysia, which is what I have been telling earlier. If it's HPV DNA, every 5 years once. If it is pap smear, first 2 years. If it's normal, just every 3 years forwarding every, if let's say the first 2 consecutive years is normal, then henceforth you can just do every 3 years once, right? And so HPV vaccination is safe and effective. Get vaccinated now to protect against HPV related cancer. So just want to give a brief, I just want to conclude here. So this will be the end of our slide today. So if there's any questions for today's topic, please leave in the comment. We will definitely answer your questions. And just to give you some, key points here, that HPV vaccination is something very important. Why? Because cervical cancer by itself is actually a preventable disease. It's a preventable cancer, and it's one of the most preventable cancer in the world, because some of the other cancers are not caused by a virus, but this is actually caused by a virus where we can prevent it. And just to add on to this, National Cancer Society has been on grounds to do HPV vaccination nationwide, including Sabah and Sarawak. We are committed to administer 300,000 doses of HPV vaccine, which is about worth 90 million, in which where we are giving it just for free. So if you have more questions, if you want to if you want to know more about this HPV vaccination program, you can definitely contact us at National Cancer Society. We are targeting more to marginalized girls. So if you know any community or any organization that actually wants to be in touch with us, please be in touch with us. Right. So let's look at some of the questions that we have. We have about 3 questions here. So for the first question, Miss Menaga Subramaniam actually mentioned here that HPV DNA screening pickup rate is increasing, but how the result is managed clinically. If no HPV strains detected, then clear direction where 5 years once repeat the test. If let's say few risk is detected, Then what is the direction or recommendation? How frequently monitoring required? What kind of monitoring is recommended? So to address this question, thank you so much. That's a very good question there. So if there's no any strains detected at the first HPV DNA, so you just repeat it every 5 years. But if there is any risk DNA risk subtype that is detected, we have to proceed for a colposcopy. So this colposcopy will be a direct visualization by an obstetrician or a gynecologist. They would actually visually see and come up whether this particular person requires a biopsy or not. And then following that, we will still maintain, in which way we would actually ask to go for the recommendation of pap smear to repeat it within a year, or if if it is still positive after a year, you still have to go back again for the biopsy as well, right? So going on to the next question, from Skylane Creative: if HPV in female leads to cervical cancer, what type of cancer does men have a high risk of having due to HPV? So that is also one of the questions that I actually addressed earlier. So when men are detected or infected by HPV, they are prone to get anal cancer and penile cancer. These are the two most common cancer post HPV infection among male. And also they are they are also probably exposed to getting genital warts as well, right? And also, can we go to the last question of the day from Mr. Wong Ban Hin? Can HPV vaccine protect against all type of HPV? Right, so that's a very good question. So what a study has said is that we have about a total of 11 high risk subtypes of HPV related infection at the moment in Malaysia. That is what we are seeing. And among that, we are trying our best to identify the most common. So, for example, the most common would be HPV high risk 9, 11, 18, and also 31. So these are the high risk subtypes that we have identified that is most common in Asian, among Asian, and also among Malaysian. So those are the high risk subtypes that we are covering through HPV vaccination. But to answer, we are unable to protect all sorts of sub risk high types, but we are actually trying our best to cover the most common ones as well, right? So that would be the last question of the day. So just to wrap up for today, cervical cancer, again, once again, I tell this, it's a preventable cancer, and HPV vaccination is key to preventing cervical cancer. So with that, I would like to end our session today. Thank you so much for listening to us. Please do continue to listen to us. We will be having a lot of live sessions after this. We will be talking a lot about our journey in leaving no one behind, living with HPV, and we'll also have personal stories and experiences shared. So thank you. With that, I sign off. I'm Dr. Rutresh Rao, Medical Officer and Community Outreach Lead from National Cancer Society. Thank you.